The Warriors of Wellness Project, the WOW project, allows health system and healthcare providers to contract and collaborate with culturally specific community health worker programs and improve communities' health by addressing the social determinants of health. This is how it works. In an effort to better serve members and improve the health of communities of color, healthcare systems can reach out to the Oregon Community Health Workers Association for help. With the support of ORCHWA, community health workers are recruited and employed by community-based organizations to provide culturally specific services to communities of color. They are trained by the Community Capacitation Center using popular education methodology to analyze the root causes of ill health and create healthier and more just communities. This way, community health workers work with individuals, families, and the community in collaboration with healthcare providers to improve population health, reduce cost, and improve the patient experience of care.
I love this work because I think community health workers are integral to our healthcare system. We have done a lot of really good work with healthcare transformation, but I think that one of the missing pieces is really how do we engage the community? You know, we don't have a lot of providers who look like our communities of color, and we don't have a lot of providers who really understand the needs of communities. They're doing the best work that they can, but there's a huge missing link, and that missing link is where community health workers shine.
Working with a community health worker, Guadalupe, helped me with an especially complicated patient with multiple medical problems. Guadalupe was able to establish rapport with this patient at home. He had gone off all of his medications. He was concerned that these medications were actually poisoning his body. And coming back to the clinic, we were able to have a breakthrough where he finally understood that these medications were helpful for him. I think without a community health worker such as Guadalupe, I'm not sure that we would have been able to effectively help this particular patient. So I think it's essential that they're part of healthcare, and teaming with us, we can better serve the patient.
In the WOW model, community health workers, their community-based organizations, healthcare providers, and funders all sit together at the table, and together we're able to identify which are the barriers that our community faces and leverage solutions to address them.
We regularly meet with doctors, nurses, pharmacists. I can share with them about the situation of the participants, and together we can find a better way to help them.
La promotora de salud, Guadalupe Ávila, me habló y le hablé de mis necesidades. El apartamento no tenía muebles y ella se ofreció una cama, me ayudó con muchas cosas más. Me ha ayudado en todos los aspectos de mi salud emocional. El doctor, en ese problema social que yo tenía, él no podía ayudarme. Hasta que llegó Guadalupe, me siento apoyada, de la verdad, grandemente por ella.
It's huge to be able to have someone who can interact with somebody on a regular basis to uncover these kinds of barriers.
We are there to fill the gap between the hospital and our community members. To be member of the community, help the provider to understand exactly what's going on with a patient. I can translate in a cultural way, in a good way, what the provider said to my community member without to create any problem. Also, the other side, I can explain to the health staff how to approach a medical issue with my community members. So it's really important in both sides if we have a community member who belongs to the community and who understand the culture and who understand the language.
WOW community health workers are able to take healthcare outside of the clinic and outside of the hospital to where community members live, work, and play. And because they're connected and they're part of a community-based organization, they're able to provide those social services such as housing, employment, food assistance that we know that are essential to improving communities' health.
I think this is a worthwhile model and worth investing in because we have an opportunity to really reach people who have been almost invisible to health systems before. Without this model, there are people who will continue to struggle through life and not know that good health care is for them.
I think that community health workers are essential for practicing healthcare in the future, and I can't imagine working without them.